Hello everyone, I welcome you again in the contraception part 2 video. So this is in English. So let's start it. So we have completed the copper T and the combined oral contraceptive pill. Now we are going to the another hormonal contraceptive pill, that is the progesterone. Okay, so let's see first the questions. The dose of progesterone released per day in Mirena. So Mirena is a intrauterine contraceptive device in which progesterone is there. So what is the dose of progesterone released per day in Mirena, they have asked. Other question which comes is preferred method of contraception in lactation. Okay, as already studied in combined oral contraceptive pill, that estrogen is the component which suppress the lactation, so it is not given while the patient is lactating in the first 6 months. So here the answer to the question here is progesterone only pills. Oral contraceptives of course not given. And IUCD, progesterone IUCD or the other IUCDs, you all know that IUCD is a procedure, right? So of course pills are preferred more than the procedure. And injection dumpa depot medroxyprogesterone acetate, it is again only a progesterone injection, but still the pills are easily available, so they are preferred. Okay. Okay, let's study progesterone only contraceptive pill. Already discussed in the previous question that progesterone does not affect the lactation, so it can be given in the postpartum period, unlike combined oral contraceptive pills. Okay, this progesterone on pills, they are started after 6 weeks of delivery. Okay, they are not as such patient have delivered today and we will start it tomorrow. No, it's not like that. It is started after 6 weeks. Why? Because they are steroidal compounds. Progesterone are the steroidal compounds, and you all know that postpartum up till 6 week the lady has the lady's increased coagulation factor does not stabilize. So progesterone only contraceptive pills, they are given after 6 weeks, when and the coagulation factor they get normalized. Okay, now the common side effect of all the progesterone only contraceptive pill, any progesterone only contraceptive pill, is irregular bleeding. Okay, it is common to all progesterone only contraceptive. Now let me tell you, the progesterone only contraceptive pill, they have an additional action, that it treats menorrhagia. How they treat menorrhagia? You know that the action of progesterone on the endometrium is that the in the first 14 days of the menstrual cycle, estrogen proliferates the endometrium, and in the last 14 days, the function of the progesterone is to, in the normal menstrual cycle, it is to stabilize, or you can say to stop the proliferation, right? And make the endometrium secretory. So as in progesterone only contraceptive pill, we are daily giving the progesterone. So from the day one we are giving, day one of the cycle we are giving, so it will not let endometrium to proliferate. It will stop the endometrium from proliferating. So the bleeding which occurs after taking this pill is very less. Okay, while taking these pills is very less, so it treats the menorrhagia. And as you all know, because now the proliferation is less, so these patients, they are less prone to endometrial cancer. Okay, so these are some of the facts which are common with all of the progesterone only contraceptive. Okay, now let's see what are the progesterone only contraceptive. First is the progesterone only pill, mini pill. They are preferred during the lactation, of course. So different progesterone containing pills are there. These days, desogestrel is coming. Okay, these progesterone desogestrel is coming in the pills, and its trade name is Cerazette. It inhibits the ovulation. Okay, you know that when progesterone is being given from the day one, it will act to the hypothalamus and block the LH surge, and thereby it will inhibit the ovulation. And when the excess progesterone will act on the cervical mucus, it will thicken the cervical mucus also. Initially, what all progesterone only pills were given. mm, they used to just thicken the cervical mucus. The one traditional combined oral contraceptive, sorry, the traditional progesterone only pills, they used to only act on cervical mucus. They used to thicken the cervical mucus. But the newer progesterone only pills, these desogestrel containing pill or serazeti pills, they do thicken the cervical mucus, and also they inhibit it or suppress the ovulation. Okay. Now these pills, they one major drawback why the clients were not compliant with these pills was that these pills, they have to be taken daily at the same time. For example, I have taken this pill at 8 a.m. in the morning today, so I have to take very another day on 8 a.m. If the lag is there of 1 hour, if I forget the pill for 1 hour, then the contraception action will goes off. So this was a very major problem, and that is why the client compliance was very less in this pill. Okay, so as pills were very hectic to take on the same time, so their sustained release formulations were prepared of these progesterone only pills. Okay. First sustained release preparation is injection DAMPA or depot medroxyprogesterone acetate. It contains the progesterone medroxyprogesterone acetate, and it works for 3 months. It is given IM. It has come in the government supply with the name of Antra. Injection Dampa as it is given intramuscular or subcutaneous, so it is has no effect on lipid and fat metabolism. So it is for 3 months. So as the name is itself telling that it contains medroxyprogesterone acetate, and it works for 3 months, and it is given IM, by IM route. Okay. The another sustained release formulation is the implant imiplanon. Okay, this dampa was for 3 months. This is for 3 years, and it is inserted subdermally in the arm. Okay, this implant is inserted subdermally in the arm, and it has a very newer progesterone, desogestrel. Okay. Now, this you all know, this is levonorgestrel IUCD, which is known as Mirena. It contains the progesterone levonorgestrel, and it is for 5 years. That was a question which was asked, that how much daily progesterone is released. You must be knowing that the Mala D, it contains 150 mcg. Okay, Mala D contains 150 mcg. Okay, so it means that the progesterone, as it is a intrauterine device, so it must be less than this. Okay, so it is almost 10 times less. Okay, so it is 20 mcg daily release. Okay, total progesterone in it is 52 mg. Okay, as it is a intrauterine device, so whatever progesterone is needed by the uterus is available nearby only. Okay, for contraception and for treating menorrhagia is nearby only. So this Mala D has a very less sorry, this Mirena has very less progesterone. On the progesterone in the Mirena is levonorgestrel. Okay, and it is almost 1/10 of the Mala-T, that is 20 mcg. Okay, the total progesterone which is quoted in the Mirena is 52 mg. This is Mirena, and this is copper T. Okay, the tea in which copper is coated will be copper tea, and the tea in which a sustained release formulation is coated will be the Mirena. So this is how you can differentiate between copper tea and Mirena. Okay, now let's study the another method, the permanent sterilization. Okay, so permanent sterilization is basically a surgery in which we ligate the vas deferens of the male, and we call it vasectomy. These day latest is a non-scalpel vasectomy. Okay, now for example, we have ligated the vas deferens here. Okay, this was reference was coming from the testes, and we have ligated it here. The all the sperms which will be present distal to the block, this was then going in the penis, like this. Okay, so all the sperms which are present distal to this block, now no more new sperms will come from the testes, but all the sperms which are present distal to the block can conceive this client's wife. Okay, so these sperms they take 3 months or 20 ejaculation to empty, whichever is later. It's best to confirm the sterility status by getting the semen analysis done. Okay, now let's discuss about the tubectomy. As you all know that in tubectomy is a permanent sterilization method of the female. In the tubectomy, in the fallopian tube is ligated and then cut. Okay, Eh, and usually isthmus portion is ligated and cut afterwards after the ligation, because the chances of recanalization are maximum with the chances of recanalization are maximum with when the tubectomy is done at the isthmus part. So it is very important that tubectomy has to be done on the isthmus part, because then only. Yes, it is very important that tubectomy has to be done on the isthmus. So it might happen that some any tragedy or in patient any case wants its tubes to get recanalization. So it's better to do it on isthmus. Okay, as the chances of recanalization are maximum over there. Now you all know that fallopian tube is in the peritoneal cavity. So to hold that fallopian tube and do the surgery, we need to approach the peritoneal cavity, and we approach the peritoneal cavity either by laparoscopy or by laparotomy. So these are the two methods which we usually do. But you should remember that the we do a postpartum sterilization, that is we do up till 7 days. From the day of the delivery up till 7 days, we can do the postpartum sterilization, and this postpartum sterilization we can never do it by the laparoscopic mode. Okay, so we have to always do it by the mini lap. Mini lap means not mini laparoscopy, it is mini laparotomy. Mini laparotomy, basically it is called mini laparotomy because only we have to catch the fallopian tube and take it out and do the surgery. So very small, mini small scar is given, almost 2 centimeter, to catch the tube. Okay, so laparoscopic surgery it cannot be done, can't be done postpartum. And so if a patient wants postpartum um, uh, uh, permanent sterilization, then that has to be done up then that can be done up till the 7 days, after the 7 days of the delivery, because up till that time only the uterus is a pelvic organ. After that the uterus is abdominal organ. After that uterus becomes pelvic organ. So it is very difficult to catch those fallopian tube once the uterus becomes pelvic organ. Okay, the most common technique by which we do mini lap is a modified pomeroy technique. Okay, let's see what is modified pomeroy technique. You can see here, this is modified pomeroy technique. First we catch the This catch the tube by the help of the Bobcock's forceps. Okay, then we ligate the tube by a thread, and then we cut it. After ligating up the and here we are ligating which part already told to you. Here we are ligating isthmus. Okay, then we ligate the isthmus. See, you can appreciate here we have we have uh, catch hold the isthmus part, and then we cut that loop the which we have ligated, the loop which we have made and ligated, then we cut it. Okay, so then again it is embedded. So once the question come here in the NEET PG was that, and this instrument is used in which procedure. So one thing I would like to tell you, all those instruments which are these sorts of circles at their one end, it means these circles are there to put the fingers. Okay, and then operate. So these all are they are laparoscopic surgeries. Now this instrument has the pongs at the another end. So it is a by this circles you come to know that it is a laparoscopic instrument, and these pongs they are used to hold the fallopian tube. Okay, so the answer to this question was lab sterilization. So this was a question of non-scalpel vasectomy. False is that sterility is not immediate. Sterility is after 3 months or 20 ejaculation, and it should be confirmed by the semen analysis. Now there comes the concept of emergency contraceptive. Now they're asking which is not an emergency contraception. So now here I would like to tell you that there are three type of drugs which prevent pregnancy. So one is contraception, number two is emergency contraception, and number three is abortive drugs. To understand this drug and their mechanism of action, I would like to divide the process of conceiving into three parts. One is before coitus, one is after coitus till implantation. Okay, so what is contraception? If before making coitus we go to the doctor and adopt some measures to prevent the pregnancy, then it is contraception. Okay, if after the coitus we go to the doctor and want to prevent pregnancy, and that pregnant uh, and that method is act before implantation. Okay, so now what we all think is that at any drug which acts after coitus is emergency contraception. No, emergency contraception means only those drugs which act after coitus but they prevent implantation. Okay, the drugs which prevent pregnancy after implantation are abortive drugs. Okay, so you will see now that whenever any emergency contraception is given, then in the last it is given one of the option is there is mesoprost. So mesoprost is not emergency contraception. Emergency contraception means those drugs which when given after coitus prevents implantation. Okay, that is why they are also known as interceptives. Okay, abortive drugs are those drugs which act after the implantation of the fetus. Okay, so you know that from the period of fertilization to implantation is 16 days, sorry, 6 days. The period between the fertilization and implantation is 6 days. So what all emergency contraception we have to give should act between those 6 days. So it becomes necessary, as we have limited time, so it becomes necessary to give high dose of those drugs. So you know that the two main hormones which act on the endometrium are the estrogen and the progesterone. Okay, so we will make the endometrium unfavorable so that implantation occurs, and that we do by giving high dose estrogen and high dose progesterone, because whenever we give that estrogen or progesterone, then they act on the endometrium and make the endometrium unfavorable for the implantation. Okay, so emergency contraception is to be taken after contraception, and they prevent implantation. Okay, and here we mainly target the implantation. We don't want the fetus to implant. Okay, let us see what are the various methods. Okay, so the first method is the method of choice, and government has made it available over the counter. What are over the counter? Over the counter means those drugs which can be available without the doctor prescription. Okay, so the trade name of it is I pill or unwanted 72 morning after pill. Okay, so the drug here is high dose progesterone. Beside inhibiting implantation, as you know that progesterone can also inhibit ovulation and tubal motility, because high dose progesterone will inhibit the LH surge. So these are all the mechanism of the eye pill, which contains mainly high dose progesterone, and the dose is almost 10 times. As I already told you, we have very less time, 6 days. So though this dose is almost 10 times of the Maladi. In Maladi, there is 150 mics of levonorgestrone. So here it is 1.5 mg, so it means it is 10 times. Okay, sometimes the pack in which this ipil is there, it contains 0.75 mg. So if 0.75 mg is tablets are there, then there will be two tablets, and both of them have to be taken at a gap of 12 hours. Okay, and they are only effective up till 72 hours of unprotected intercourse. Means if the intercourse has been done in the morning at 4 o'clock, so up till 3 days, if this emergency contraception is taken, or if this pill is taken, then only it will be effective. If it is more than 3 days, then it will not be effective. Okay, similarly, as we have given high dose progesterone, we can also give high dose estrogen. It will also inhibit implantation, no doubt, but it is not given because the high dose estrogen causes lot of nausea, vomiting. So Yushpi was one of the doctor, and he said that we are giving high dose progesterone, we are giving high dose estrogen. Why don't we give the combined oral contraceptive pills as they are freely available? Okay, so UHP said that as this combined oral contraceptive pills, they contain both estrogen and progesterone. So at the time when UHP suggested, so he find that the two doses of combined oral contraceptive pills given in the morning and two doses given in the evening after 12 hours will prevent the pregnancy. Okay, so because these days there are very less estrogen and progesterone as compared to the time of the UHP. So these days, if we want to follow the UHP regimen, we have to take 4 tablets in the morning, then at a gap of 12 hours, again 4 tablets in the evening. Okay, fourth is the fourth drug which we use is the mifepristone. You all know it is the anti-progestin. It inhibits, as it is anti-progesterone, it inhibits the implantation. It has to its dose is 10 to 50 mg. It can be asked in paper. Doses of emergency contraceptive are quite frequently asked. It is effective only up till 72 hours of the unprotected intercourse, and it is not available in India. There are two methods which we can use up till 5 days they are uliprestol and copper T. Uliprestol is active up till 5 days. Copper T is also active. We can use it up till 5 days. Okay. So uliprestol is a selective progesterone receptor modulator. So its dose is 30 mg. It was once asked in NEET PG. So please you have to remember each and every dose. So you all know that copper T has a drug copper. It inhibits the implantation and it is freely available. Okay. Dose of levonorgestrel for emergency contraception is 1.5 mg within the 72 hours. Now let's take this question. Not used as emergency contraception, copper T is used. RU486 is the another name of the mifepristone. So danazol is not was not there. High dose estrogen can be used. So here the woman has come post coitus 96 hours. So 96 hours and that is equal to 4 days. So best contraception method in best emergency contraception will be yes IUCD because IUCD can act up till 5 days and uliprostol to act up till 5 days. Okay. Now let us see what is Pearl index. When one lady is using the contraception, so there are quite chances that that contraception can fail. Which contraception fails? How much is told by Pearl's index? What is Pearl index? Pearl index still that if that particular method of contraception is used for 100 is used by 100 women for a year, then out of those 100 women, how much of women get pregnant. Okay, so of course this Pearl index indicates accidental pregnancy, nothing else after the use of even after the use of contraception. So of course now Pearl indicate in Pearl index it indicates is a failure of the contraception. More is a Pearl index, lesser efficient is the contraception. Okay. Now vasectomy and tubectomy, though they are surgical procedures, but there are some contraception which even have a more efficient or less Pearl index than vasectomy and tubectomy. So you're never going to think that as vasectomy and tubectomy are permanent, they are surgical method, so they have the least Pearl index. No. Implants and levonorgestrel I use implants, they are the one of the method which have least Pearls index. Levonorgestrel have levonorgestrel intrauterine device is equal to tubectomy. So if a lady gets levonorgestrel or tubectomy done, so equal chances of pregnancy are there or failure of that contraception are there. Copper T and combined oral contraceptive pills are both have point 0.5. Progesterone only pill is more because it is very difficult to take it. It want to barrier and natural method they have almost the same. Barrier have 20 and natural method are 25. This was a one concept which the patients were very compliant, that is LARC. LARC is long acting reversible contraception. Okay, so long acting reversible contraception means that patient has to take less frequent that contraception and that contraception acts long. So minimum frequency for which the contraception to be taken to be classified as LARC is once per month. Okay, so in the LARC comes copper T. Copper T has to be replaced either it's 2 year, 3 year. Copper T is for 2 year, 3 year. Levonorgestrel IUD or Mirena is for 5 years. Implants is for 3 year and injection Dampa is for 3 months. Okay, so these all are come the uh, drugs which or contraceptive methods which doesn't come here is the laparoscopic tubal ligation because they are not reversible. So LARC contains all those methods which are long acting plus they are reversible. So this question is expected this time in the exam. Pearl index is lowest in. So I've already told you in spite of the fact that Pearl's index In spite of the fact that vasectomy and tubectomy are surgical procedure, even though the Pearl index of them of the imiplanon or implant aunt is more, is less. So implant is 0.05 and vasectomy is zero point 0.1 and tubectomy is zero point 0.2 and Mirena is also zero point 0.2. So the implants have the least Pearl index, that is they fail, this contraception fails the least. Okay, so here is the question, all are lark except, right? The answer to this question is lap tubal ligation, because copper T is also long acting and reversible, imiplanon is also long acting and reversible, and mm, Dampa is also long acting and reversible. Okay. Now let's see the barrier method. This was a question which came in FMG June 22. What does this contain? So this contains mainly the vaginal sponge. On today contain is a vaginal sponge. It is a barrier contraceptive of the females, and it also contains a spermicidal jelly. So the spermicidal jelly most commonly used is the nonoxynol 9. Okay, this is a female condom. As you're seeing, it's quite has a big diameter and it's quite lengthy. So of course it is a female condom. Male condoms have a very small diameter and they are not so lengthy. Okay, so let us see barrier methods. So condoms are the barrier method. They are male condom and female condom. The trade name of the female condom is femidom. Diaphragm, cervical caps and vaginal sponge, these all are the female contraception. Some other contraception barrier contraceptive than condoms. The drawback of these are that if the female forgets to take out that barrier contraceptive, then and if it is left there for more than 24 hours, then they cause a septic shock syndrome. The another drawback is that they have a very high failure rate, and the instructions are usually not followed how to use the barrier contraceptive. Okay, so to increase their efficiency they are coated by the spermicidal jelly nonoxynol 9, one thing. And the good thing about the barrier method is that they prevent all STDs. So these are some of the barrier methods. This is a male condom. This is a female condom. You can see female condom is much more big. This is diaphragm and this is cervical pad and this is spermicidal jelly. So you can see these rings and these patches. They are also contraception method, but these are not barriers. Okay, these are combined oral contraception, hormonal contraception. So one is the natural method. As you all know, on the 14th day, ovum gets ready to fertilize the sperm. So if a lady doesn't make intercourse during the during the in between 2 weeks, then there are less chances that the lady will conceive. Okay, so if one client does not want any method to be used, then it will be okay that that client to use a natural method. And as already seen, of course this natural method have very lesser efficacy, and the safe period is to make intercourse without conceiving is the first 7 days and the last 7 days. And they are also one lady can also appreciate its ovulation by feeling the wetness of the by feeling the wetness in the vagina and by noting its temperature. As the progesterone is a thermogenic hormone, so there is an increase in the temperature by 0.5 degree Fahrenheit, not centigrade. And just before the ovulation, estrogen levels are at peak, and these estrogens, they make the cervical mucus thin, please remember, and gives the cervical mucus a spin bucket effect. So whenever the lady feels wetness in the vagina or notice the 0.5 degree Fahrenheit increase in the temperature, it means they are the ovulation days. So the lady should avoid the intercourse during that days, as the chances of fertilization are maximum. Billing method, rhythm, they are these, and this natural method is also known as billing method, rhythm method, and behavioral method. So that was all about the contraception part 2. I hope it helped you to understand the concept. Thank you.